I'm going to be doing a pediatric assessment today. While I'm doing my assessment, there's a few things I want to be looking for. I want to look for growth symmetry, overall hygiene, such as oral hygiene, see if the nails are clipped, see if the patient's bathed. I want to look for eye contact. I want to look for mood and behavior, level of consciousness, and activity. So, the first thing I'm going to do is come into the room and I'm going to introduce myself and perform hand hygiene and put on gloves. I'm going to tell the patient what I'm going to be doing, which is going to be doing a pediatric assessment. I need to verify the patient by getting the child's name and their date of birth off their bracelet. I need to acknowledge the mother. Once I've done all that, I am going to start at the hair. I want to check the hair and smell it, see if the child is bathed, maybe ask them if they bath every day. The child does. So I'm going to move on to the eyes. I'm going to take my pen light and ask him to focus on my pen light, checking pupil size, shape, reactivity to light, and accommodation. I want to make sure that the conjunctiva is pink and the sclera is white. Once that's done, I'm going to check the nose. I'm going to take my pen light and shine it up their nose, checking to make sure that the airway is patent and that there's no discharge. And next I'm going to go to the ears. If the child is under 3, I'm going to pull down on the pinna. If they're older than 3, I'm going to pull up on the pinna. I want to take my pen light and shine back in the ears, see if I see any discharge. That's normal, so I'm going to proceed to the mouth. I get the child to say ah, shine back into the child's mouth. See if the mucous membranes are pink and moist. See if the lips are pink and moist and the tongue as well. I also want to check for any loose or missing teeth. This child doesn't have any, so I'm going to proceed to the lymph node area. I check the lymph nodes. I'm checking for any signs of enlargement, swelling, tenderness. The child doesn't have any. So I'm going to check the carotid artery, one side at a time. It's strong and equal bilaterally. So I'm going to move on to the child's trunk area. I look at the trunk. I'm looking for any bruises, abrasions, lesions, anything like that. I don't see anything, any rashes. Don't see anything, so I want to check the child's skin turgor. Skin turgor is good, less than 3 seconds. So now that I'm out the child's trunk, I'm going to assess the heart and lung sounds. So I'm going to get my stethoscope. Listen to the heart for 1 full minute. The child's heart rate should be between 65 and 110 beats per minute. I'm listening for any murmurs. I listen to all 5 heart sounds. The child has normal heart sounds. So now I'm going to assess the respiratory system. I'm going to assess the lungs. I can look and see that the child's chest is rising and falling equally. I want to measure the child's respirations. They're going at 25 beats per minute. 25 respirations per minute. That's normal. I want to listen to the child's lung sounds, listening for any signs of crackles. I'm listening for any crackles, wheezing, bronchi. I'm also listening for any signs of respiratory distress, such as nasal flaring, retractions, and grunting, using accessory muscles. I don't see any of that. So I'm going to ask mom if the child has any, if they've been coughing anything up that's abnormally colored, any sputum that's been abnormally colored. Child's not had a cough, no abnormal sputum. So I'm going to proceed on down to the belly. I want to look at the stomach or look at the belly and make sure that it is flat and non-distended. It is. So I want to listen to the bowel sounds in all four quadrants. So I'm going to check all four quadrants. Bowel sounds are active, normal. So next I'm going to palpate the belly, the abdomen. I want to push down soft at first, see if the child has any pain. If the child has no pain, I want to press down harder, see if the child has any pain with pressing harder. The child doesn't. So I'm going to ask the child, actually I'm going to ask I want to be able to see if I can palpate the bladder. I should not be able to palpate the bladder, so in this case I can't, so that's normal. So I asked the mother if the child has been having any troubles going to the bathroom. Has their stool been abnormal? She says it's not. The child's not having any trouble, normal stools. So I'm going to ask the child when was the last time they went to the bathroom and peed. This child said it was about an hour ago. So I'm going to proceed to the arms. I'm checking for muscle tone, strength. Child's arms look normal. I'm going to move on to the brachial pulses one at a time. They are strong and equal bilaterally. So I'm going to move on to the child's hands now to check the capillary refills. So I check the capillary refills on the child. They're less than 2 seconds and the nails are clipped. So that's normal. I want to check range of motion on the child. Get the child to perform a range of motion exercise and ask if there's any pain or any crepitus. There's not. So we're going to proceed on to the legs. Okay, now that I'm at the legs, I'm going to be looking for bruises, lesions, rashes, abrasions, any kind of skin conditions, really. I do see that the child has a scab on their leg, so I asked the child how they got the scab. Said they wrecked their bicycle. So this is a good time for me to educate the child and remind them that it's always a good idea to wear their helmet at all times while riding their bike. I take my cotton tip applicator pad and measure the scab. It's 1.5 centimeters by 1.5 centimeters. Next, I want to also want to check the color of the scab, color, shape, size, any signs of infection. Child has none. It's just a normal scab. So we're going to proceed down to the popliteal pulses. We check those. Those are normal, strong and equal bilaterally. Same thing with the pedal pulses, strong and equal bilaterally. So I want to check the child's capillary refill in their toes, less than 2 seconds, so that's normal. Next, I want to have the child take their feet and push them up against my hand. I want to check strength. Child's strength is good that way. Now I want to take I want to put my hand over the child's feet and tell them to pull up. Child does that, that's normal. I would like the child to perform some range of motion exercises. I want them to bend their knees and just take their ankles and make circles with them. See if they have any pain or discomfort, crepitus. They don't. So we're going to continue on with the evaluation or the assessment, and we're going to do some neuros. First thing I'm going to do is orient the child to person, place, and time. So I ask the child what's the name. The child gives me the name, it's correct. Next, I want to ask the child where they are. The child knows that they're in the hospital, they just don't know the name of the hospital, so that's okay. And now I want to ask the child what time it is by asking them if they just had breakfast, lunch, or dinner. Child answers all the questions correct. So I'm going to check the extremities of the child. And the way I'm going to do this is I'm going to ask the child to close their eyes and take my cotton tip applicator and touch each one of their extremities without telling the child which extremity I'm touching, and see if the child can feel the soft side of the applicator on any of the extremities. Child can. Keeping the child's eyes closed, I'm going to switch to the hard side. I touch the child's extremities. Child can feel all those. So child passes the neuro assessment. I'm going to ask the child to turn over on their side. I want to check to see if the child's skin is okay on their back. It looks normal. The spine looks to be in alignment. That looks normal. Now I need to listen to the lung sounds on the back of the child. I listen to the lung sounds on the back of the child. Those are normal, so I ask the child to turn back over on their back. They do. Now I need to get on a pair of clean gloves because I'm going to have to check the genital area. So I take my gloves off, perform hand hygiene, and put on new gloves. Now that I have new gloves on, I'm going to assess the child's genitalia. I'm checking for, first I ask the child if they are having any issues down there, such as itching or burning. Child doesn't have any issues. I need to tell the child this is a private area that only nurses, doctors, or their parents are supposed to see. Don't let anybody else see that area. And I also want to note if the child has any abnormalities. Now, this child doesn't have any abnormalities. Everything's normal. So I ask mom if the child has reported anything to her. Mom says the child's not. So now that the assessment, the genitals are normal, mom reported nothing. Talk to the patient about who should see their private area. They have no issues down there. I'm going to wash my hands again. Take my gloves off, then wash my hands. And I'm going to talk to the patient now. I ask the patient if they have any questions. They don't. I want to tell the mother that everything in the child's assessment was within normal limits. No issues. I want to make sure to lower and lock the bed and give the child the call lock. So I do that, and before I leave, I ask the mother and the child if there's anything else I can do for them. They both say no, so I'm going to thank them for letting me do the assessment and go ahead and leave the room.